Hi everyone, my name is Glyza Claire Valles and today I will be presenting Major Depressive Disorder. This presentation is submitted to Professor Leslie Sparling for ConEd Mental Health Nursing course in Saskatchewan Polytechnic. Major depression, also known as unipolar or major depressive disorder, is characterized by a persistent feeling of sadness or a lack of interest in outside stimuli. A diagnosis of major depressive disorder means you've felt sad, low, or worthless most days for at least 2 weeks, while also having other symptoms such as sleep problems, loss of interest in activities, or change in appetite. This is the most severe form of depression. MDD is one of the most common psychiatric disorders. Women experience depression approximately 2 times more often than men, and approximately 1 in 8 adults have identified symptoms that met the criteria for a mood disorder at some point during their lifetime. Depression is the leading cause of disability worldwide. The exact cause of depression is unknown. However, researchers have linked certain risk factors to an increased incidence of developing depression. Risk factors for MDD include female gender, early childhood trauma, stressful life events, family history of depression, especially in first-degree relatives, high levels of neuroticism, or a negative personality trait characterized by anxiety, fear, moodiness, worry, envy, frustration, jealousy, and loneliness. Other disorders such as substance use, anxiety, and personality disorders. Chronic or disabling medical conditions. The anatomy and physiology of the brain. Forming the basic structure of the nervous system, neurons generate electrochemical impulses and transmit information. Neurotransmitters are the chemical vehicles that allow neurons to transmit these impulses smoothly. The neurotransmitters serotonin, norepinephrine, dopamine, and gamma-aminobutyric acid are produced in neurons and stored in the synaptic vesicles until release. After release, any neurotransmitter not used during impulse transmission is sent back to storage through a reuptake mechanism. In depression, levels of serotonin or dopamine are inadequate, causing symptoms of sadness and a feeling of emptiness. This is what a normal versus a depressed brain looks like. In a normal brain, normally brain chemicals carry messages from one brain cell to the next. In depression, there is an imbalance of brain chemicals that can change the way brain cells communicate, and this can change a person's mood. Normal brain has regular size hippocampus, while the depressed brain has shrinkage in size of the hippocampus as seen in the picture. Also, depressed brain has an abnormal number of neurotransmitters. MDD is divided into subtypes called specifiers, which are the following. First is the seasonal affective disorder or SAD. It is categorized as a disease directly caused by the time of the year. Next is the psychotic depression. It often develops if a patient has been hallucinating or if they believe in delusions that are not cohesive with reality. Next one is postpartum depression. It is a common occurrence among new mothers experiencing hormonal changes following childbirth. Fourth example is melancholic depression. It exhibits the most typical signs of depression, including weight loss and decreased interest in activities they once loved. Fifth one is atypical depression. It is often directly related to the mood and to interactions with others. Symptoms include hypersomnia, heaviness in the limbs, and social anxiety. Last one would be catatonic depression. The patient experiences motor problems and behavioral issues. And also, the patient might be immobilized or have involuntary movements. to be diagnosed with MDD, a patient needs to meet the symptom criteria listed in the Diagnostic and Statistical Manual of Mental Disorders 5th edition, or the DSM-5. So this manual helps medical professionals diagnose mental health condition. So according to its criteria, a patient must experience a change in previous functioning. Also, a patient should have symptoms, or symptoms must occur for a period of 2 or more weeks. Next criteria would be at least one symptom is either depressed mood or loss of interest or pleasure. Also, a patient must experience 5 or more of the following symptoms in the 2-week period. Feel sad or irritable most of the day, nearly every day, less interested in most activities they once enjoyed, suddenly lose weight or gain weight, or have a change in appetite. Patient also must have trouble falling asleep or want to sleep more than usual, experiences feelings of restlessness, feel unusually tired and have a lack of energy. The patient must also feel worthless or guilty, often about things that wouldn't usually make them feel that way. Last one would be they think about harming themselves or suicide. And this is our patient profile who is nearing for discharge. The name of the patient is Mrs. Potter. She is 58 years old, a female and of a Métis, and she lives in Regina, and she lives also alone. Her diagnosis is major depressive disorder. History of psychobiological disorder is new onset, and she has a comorbidity of generalized anxiety disorder. She lives alone since her husband passed away a year ago. She has no children, and her relatives lives in other province. She has also social withdrawal for the last 6 months. Our nursing process and examples of therapeutic communication. First one, the nurse states, "You look tired today. Did you get enough sleep last night?" The patient replied, "I haven't been getting much sleep lately because of so many racing thoughts in my head at night." So this is an example of making observations. Observations about the appearance, demeanor, or behavior of the patients can help draw attention to areas that might pose a problem for them. Without appearing judgmental, a nurse should be ready to make their perceptions of the patient and his or her condition known. Next example is of a therapeutic communication is giving recognition. The nurse states, "I notice you took all of your medications." So a nurse should always provide the patient with recognition for positive changes and improvements in any area concerning his or her case. Such positive reinforcement like this encourages the patient to take the positive attitude toward the management of his or her health and treatment. Our first diagnosis for nursing process is risk for suicide related to depressed mood and feelings of worthlessness. Our treatment goal for this patient will be the patient will state that she wants to live and avoid inflicting harm to self. Also, the patient will identify resources and support groups that she can seek out for support and guidance when she is in need for help. Our nursing interventions for this case is to create a safe environment for the patient. Also, we will encourage patient to express her feelings. And lastly, arrange counseling and therapy from related groups of people that can help the patient with her suicidal thoughts. Our treatment outcome for this nursing diagnosis would be the patient stated the desire to live and no self-harm reported. The patient also identified resources and support groups that she can attend to upon discharge. The next nursing diagnosis will be alteration in nutrition less than body requirement related to loss of appetite. Our treatment goal for this diagnosis will be patient will maintain her nutritional and fluid status and also improve the quantity of her food intake. Nursing interventions would be explain nutrition and patient's personal and nutritional needs. Also, encourage more frequent feedings and allow the patient to choose what to eat and give enough time to do so. Next one would be to encourage the patient to eat with others. The treatment outcome would be the patient maintained her nutritional and fluid status, and also the patient improved the quantity of food intake. Pharmacological interventions. The selective serotonin reuptake inhibitors, or SSRIs, it is a recommended first-line therapy for most types of depression. An example of a SSRI medication is fluoxetine or Prozac. Fluoxetine affects certain chemical messengers or the neurotransmitters that communicate between brain cells, and that helps people with depression, panic, anxiety, or obsessive-compulsive symptoms. The following are the possible side effects while taking Prozac. First would be nausea, vomiting or diarrhea, headache, drowsiness, dry mouth, insomnia, nervousness, agitation or restlessness, and dizziness. These are the following patient teachings while taking the medication. There are some young people have thoughts about suicide when first taking on antidepressant. The patient should stay alert to changes in their mood or symptoms. Prozac also could impair judgment, thinking, or motor skills. So the patient must use caution when operating machinery. And also the patient should report any new or worsening symptoms to their doctor, such as mood or behavior changes, anxiety, panic attacks, trouble sleeping, or if they feel impulsive, irritable, agitated, hostile, aggressive, restless, hyperactive, mentally or physically, they are more depressed or have thoughts about suicide or hurting themselves. Also, we should teach the patient to do not stop using Prozac without first asking their doctors. The following are the patient resources, community support for patients who are experiencing depression. First would be Caring Hearts. This is for the patient who lost her husband a year ago. She can go to Caring Hearts Grief and Bereavement Mental Support in Regina, Saskatchewan. The phone number is 306-523-2780. Next community support is the Canadian Mental Health Association in Regina Branch. The phone number is 306-525-9543. And last community support is Regina Adult Mental Health Clinic. Telephone number is 306-766-7811. These are the crisis intervention resources for patients in Regina. She can call Regina Mobile Crisis Services in 211 Saskatchewan. This is open 24/7, and the phone numbers are listed on the screen. For immediate help, she can call these emergency contact numbers. And these are the references for my presentation. Okay, that's the end of my presentation. Thank you so much for watching, and have a great day, everyone. Thank you.